Hello, everyone, and welcome to the first monthly Sjogren's and Gut Care series. My name is Cristina Montoya. I'm a registered dietitian and a Sjogren's advocate in Canada. I started this series to spark a conversation about gut health in Sjogren's because for many years I've seen patients and I've seen it in myself that gastrointestinal manifestations are real in Sjogren's, and Sjogren's can actually affect the entire gastrointestinal tract. So today I bring to you understanding the low FODMAP diet for Sjogren's, specifically if you are experiencing irritable bowel syndrome symptoms, but you will learn more about this as we dive into the presentation. You will learn more about the IBS diagnosis, how the FODMAP triggers IBS symptoms, how you can follow the low FODMAP diet for Sjogren's. You will also learn about the gentle approach to low FODMAP diets, other interventions, and I will just talk a little bit about probiotics and answer a few questions that were submitted ahead of time. So I hope you enjoy this presentation, and I'm looking forward to seeing you in the next months and the next sessions to come. Bye. As a reminder, the information provided in this presentation should not substitute the specific advice from your physician. I have no conflicts of interest. The products presented in this session are solely for the educational purposes. Now, Sjogren's Family Feud. I asked over 100 individuals with Sjogren's across the globe in 2023 if they presented any digestive symptoms in the past 6 months. Basically, 9 out of 10 individuals say yes. And here are the most common digestive symptoms experienced. So for the purpose of today's presentation, I will focus mainly on constipation and diarrhea. But I really want you to really look at the numbers of constipation because there was a study of 150 Sjogren's patients followed at a French hospital. And it was found that 95% of them experienced abdominal symptoms. And more than half of the patients presented with constipation. So the results of my humble survey and this research are very similar. And what really struck me was that researchers concluded that despite the frequency, digestive symptoms are not part of the ESSDAI activity score for primary Sjogren's syndrome. These acronym stands for the Euler-Sjogren Syndrome Disease Activity Index, and it's a clinical index that measures disease activity in primary Sjogren syndrome. So remember that that's basically when they're running clinical trials, they only included participants who solely were diagnosed with Sjogren's. So how is IBS diagnosed? First, according to the Living with Sjogren's survey by the Sjogren Foundation conducted in 2021, at least 1 in 3 individuals with Sjogren's reported to be diagnosed with irritable bowel syndrome. Gut dysmotility caused by autonomic dysfunction is often misdiagnosed as IBS in Sjogren's patients. So before accepting an IBS diagnosis, make sure your healthcare provider or gastroenterologist has done their due diligence by ruling out any structural or other gastrointestinal disorders or even autoimmune disorders such as celiac disease, inflammatory bowel disease, SIBO. The diagnosis of IBS is based on the use of the Rumford criteria and is a symptom-based criteria used in clinical trials and practice. IBS is now recognized as a disorder of gut-brain interaction, acknowledging the influence of the gut microbiome and entire nervous system in symptoms. And there's actually subtypes. You have IBS, predominant diarrhea, constipation, mixed, and others that are unclassified. The IBS predominant constipation, according to the Rumford criteria, is that more than 25% of bowel movements with Bristol, using the Bristol stool chart, will follow within the type 1 and type 2, as you can see here. And the IBS predominant diarrhea will be fall under the category of type 6 and type 7, so extremely loose. But one thing I wanted to bring up to your attention is sometimes there is presence of diarrhea or loose watery stools when you are suffering from IBS constipation, especially when this happens in the morning or right after the meals. We have dysmotility, so when there are altered motor function that can result in the bowel moving too quickly, causing diarrhea, or too slowly, causing constipation. So Dysautonomia International has recognized Sjogren as the second most common cause of dysautonomia. And according to the Sjogren's Foundation, GI dysmotility is the most common form of dysautonomia in Sjogren's. So food for thought there. And we also have the brain-gut axis dysfunction. So that's where we feel, I will also call the visceral hypersensitivity. So this refers on how the brain interprets signals from the intestinal nerves. So for some people, even with IBS, even a small change in intestinal activity can trigger the nerves to send messages to the brain, causing abdominal pain. And so I attended an IBS summit last year, and I really liked this image presented by a gastroenterologist, and it just will help the physicians or your healthcare provider interpret some of the symptoms. When you are reporting to your physician, oh, I'm not eating very well, I pass very small amounts regularly, so those symptoms may be related to lifestyle, fiber, and fluids, like poor fiber and fluid intake. When there is, I never get the urge to go, but I get progressively bloated and distended. So that could refer to autonomic dysfunction or altered gut motility. And then there's another issue, which is, I always get the urge to go, but I strain, and I try to go, but it just little happens. So that could be related to pelvic floor dysfunction. And that is actually quite common in individuals with Sjogren's, especially because many of us are diagnosed in our mid-40s or even 50s or 60s. And there is that inability to tighten and relax the pelvic floor, which can result in constipation. It says that even 1/3 of women in general experience pelvic floor dyssynergia, so problems in coordination. So even just going to the pelvic floor physiotherapist could be just as helpful as changing your diet in managing constipation. And so I hope you have a chance to review the email sequence. And I thought this was a really nice way to segue into the topic. Finally, what are FODMAPs and how do they trigger IBS symptoms? So FODMAP stands for fermentable oligodisaccharide, monosaccharides, and polyols, and they're carbohydrates that cannot be digested and absorbed, causing them to travel through your gut and be fermented by gut microbes. And this happens to everyone. FODMAPs are found in common everyday foods, including those with many health benefits. They're the polyols or the sugar alcohols. There is one of them that is extremely important for us who have Sjogren's because we consume lots of xylitol. How FODMAPs cause IBS symptoms? FODMAPs influence symptoms in a few ways. For example, high fructose foods and lactose draw water into the gut, loosening up the stools, causing diarrhea. FODMAPs also interact with the gut microbiome by fermenting. The FODMAPs can increase gas and bloating. Then gas and bloating can cause pain in those with hypersensitive guts. And something to keep in mind is the symptom onset is generally 4 to 8 hours after the FODMAP intake. So perhaps the foods that you have consumed in breakfast, you will start to experience the symptoms right after eating lunch. And so you probably start associating those symptoms to the food that you just had eaten, but in fact could be from the breakfast or even from the dinner before, because remember, the food takes a long time to travel down the gastrointestinal tract, even after 48 hours. And this is what makes a low FODMAP diet such a complex dietary approach because it's not black and white. Research has shown that FODMAPs may also increase low-level gut inflammation for some people with IBS. It can alter the gut barrier function, or think of that term leaky gut, can alter the gut motility and feed the overgrowth of bacteria. And small intestinal bacterial overgrowth is quite common in individuals with Sjogren's. We'll just show you the basics of how to follow a low FODMAP diet. A research team from Monash universities in Australia, they noted that reducing high FODMAP foods can improve GI symptoms in IBS. So I just had to take this image from their website because it's super clear. The low FODMAP diet, it is a 3-phase diet plan that reduces carbohydrates, which ferment and cause osmotic effects in the bowel. So the first stage is a restriction. It's not an elimination, but a restriction of high FODMAP foods, and we swap them for low FODMAP alternatives. Typically, if this dietary approach is going to work, you're going to feel some improvement around week 3. Then you have a FODMAP reintroduction phase that it takes even up to 12 weeks, because this is when we start to reintroduce to high FODMAP foods to assess tolerance. Then we'll go into a FODMAP personalization, when eventually people are able to identify what foods they're able to tolerate, which ones they would just prefer to kind of, just eat them occasionally. And here in this phase, and when we actually can start maybe introducing some evidence-based like digestive enzymes or probiotics, because now we know what we're targeting. In our goal is to go for food freedom. I don't want you to be in a restricted diet forever. So here's an example of high and low FODMAP foods. You received this in one of the emails that I sent. What's most important is that a low FODMAP diet is not a FODMAP-free diet. So remember that eventually those high FODMAP foods, we want you to reintroduce them, because many of them have incredible health benefits, especially the high content of fiber and prebiotics. So this one's a really cool question. I loved it. If xylitol gum kills bad mouth bacteria to prevent cavities, what effect does it have on the gut microbiome? Xylitol creates an unfavorable environment for bacteria in the mouth, but it does not necessarily kill the bacteria. However, xylitol is a polyol or sugar alcohol that can be fermented in the gut like any other FODMAPs. It may cause loose stools due to its osmotic effects, but overall, xylitol is safe. My understanding is that xylitol doesn't necessarily kill the bacteria, but it creates a hostile environment for the bacteria. Unlike sugars or the regular carbohydrates that we consume, they do increase the acidity in the mouth, and that's the perfect environment for bacterial growth. Xylitol is safe when consumed in less than 50 grams a day. Safe to consume, but you have to assess your own threshold, your own tolerance of xylitol. Because remember, it's not just about the xylitol containing foods, but everything else that is in your diet contains FODMAP. Question: can you share the difference between dairy sensitivity and lactose intolerance? So lactose intolerance is a clinical syndrome in which lactose ingestion causes symptoms such as abdominal pain, bloating, flatulence, and diarrhea due to lactose malabsorption. And about 70% of the world's population has lactase insufficiency. So it starts to decline as we get older, but we still can tolerate small amounts of lactose. And I've seen in many patients with Sjogren's and myself that cow's milk, like fluid milk, is a huge trigger. It has a huge load of lactose. I will avoid it altogether unless you can tolerate like lactose-free milk. But many of the cheese products, as you can see, they are actually low lactose. Oats is actually an interesting story. According to the Monash FODMAP app, rolled oats are low FODMAP if they gain like half a cup serving. But if you take the same amount, like an instant oats, they're high FODMAPs. And the same thing happened with milk. With oat milk, it's a concentrated amounts of fructans. So you may think that might be a healthy alternative, but it might be that oat milk that is giving you trouble. FODMAPs are dose dependent and they're very individualized. Let's take the banana, for example. So one medium banana that is firm and peel is completely low FODMAP. You can eat the entire banana. But as that banana starts ripening, then there is a higher concentration of fructans, and only 1/3 of that banana will be low in fructans or low in FODMAPs. There was a question about sweet potatoes, and it goes back to the FODMAP load. So one serving, so it's just like half a cup, it's low FODMAP, but as soon as you start increasing, like a 2/3 of a cup per meal, then there is more sugars, alcohols in sweet potatoes. But not all low FODMAP breads are gluten-free and vice versa. Not all gluten-free breads are low FODMAPs. So basically foods that use the bacillus started like sourdough in baked goods or like bread, that bacillus, they start to break down the fructans in the wheat. It's almost similar to the fermentation process that happens with the bacteria in yogurt. That's why people tolerate yogurt more than any other dairy product, because the bacteria had already started to break down the lactose. So that's why people with IBS can still tolerate sourdough bread, but it depends on the quality of that bread. Because if you just go to Walmart and get a regular dry, light sourdough, it still contains high amounts of fructans and it's high in FODMAP. This is why a guidance by a registered dietitian is so important, because you cannot generalize your dietary, your food preferences. You will get a list of high and low FODMAP foods on the web, but what is it that you actually have available at home? What do you enjoy? What can you swap? What makes sense to you? So the Monash University FODMAP Diet app is an excellent resource to identify, but it's still the guidance with a dietitian who understands this diet and how it behaves with your gastrointestinal tract is essential to be successful. How to spot low FODMAP foods and recipes. So the Monash University has tons of recipes. The challenge will be to identify those recipes that are both. We'll say that a Sjogren-friendly recipe is easy to prepare, easy to chew, easy to swallow, and easy to digest. And so I sent you a link to all the recipes that I consider meet all that criteria. Then we have low FODMAP certified products. Let's say you don't want to prepare those foods at home, or you just want to get a vinaigrette or a pasta sauce that already meets the criteria of being low FODMAP. So there are certain foods like 40 foods. Then you also have certain foods that meet that criteria. And so they will have the FODMAP friendly stamp or the Monash University low FODMAP certified. You may also find that a bakery near your neighborhood would actually have a low FODMAP bread, which is the case of Cope's bread. It's actually an Australian bakery franchise with locations in Canada and the US. They make low FOD buns and low FODMAP diet does not need to be a low fiber diet. And I wanted to give you this example of a very simple meal to make for breakfast, lunch, dinner, and a snack. Another thing that is very important to highlight is that when we are on a low FODMAP diet, we tend to reduce whole grains and legumes. That makes getting enough protein and minerals very challenging. A plant-based eating doesn't mean that you are going vegan, but here I'm just giving examples for those who have minimal consumption of animal products. For instance, like you can get calcium from almond and macadamia milk, tahini, kale, tofu, iron also from tofu, hemp hearts, protein foods that are plant-based like tofu, tempeh, edamame. Also foods that are high in zinc, pumpkin seeds, sesame seeds, but be careful, it has to be 1 tablespoon. And B12 are mostly found in animal products. I would say the one low FODMAP option that could work is nutritional yeast. There's a flexible approach to the low FODMAP diet, or it's called the FODMAP gentle. And personally, this is the approach that I like to take when it comes to implementing the low FODMAP diet in individuals with Sjogren's. So this approach is a more liberal restriction. The highest FODMAP foods that are commonly restricted include grains, dairy, legumes, some vegetables like onions and garlic, and certain fruits. We want to make sure that there's adequate fluid intake, that there is very modest use of alcohol, coffee, tea, and carbonated drinks. Limit, instead of consuming like 5 fruits and vegetables a day, you limit it to 3. Then you encourage to use more flaxseed if is experiencing constipation, or add also oats and flax seeds if you're experiencing bloating and flatulence or gas. So these are some of the interventions that you could do to supplement the low FODMAP, or simply you go for the gentle approach and start implementing the use of fiber supplements, some evidence-based probiotics that can support the diversity of the gut microbiome. Then you have the enteric-coated peppermint oil, especially for individuals with Sjogren's. The peppermint oil acts as antispasmodic, so you don't want to take the oil directly because it will actually expand or open up the lower esophageal sphincter and may actually increase your heartburn. So when you use the enteric-coated peppermint oil, it's supposed to bypass the stomach and the acid, so it will kind of do its job at the gut level. Then we have gut-directed hypnotherapy. So there is a program called NERVA, psychological interventions like CBT, and also exercise, yoga, and deep breathing or diaphragmatic breathing. There is food freedom strategies, and I'm not going to focus a lot on this today because this is going to be my exciting topic on February 24, all about digestive enzymes in Sjogren's. How to identify probiotics that can help relieve symptoms of IBS. First of all, one thing I want you to take away from today is that fermented foods are not probiotics. Fermented foods are foods that have been changed by microbes to improve taste, flavor, texture, increase shelf life. When you are seeing fermented foods, they are refrigerated. You don't find them there on the main aisles of the grocery stores. They're usually refrigerated, so that way you know they're preserving their live bacteria. The probiotics, on the other hand, they are microorganisms that need to be alive in a specific dose for a specific health benefit. So they need to meet these 3 S's criteria. Strains are known, they're in specific doses, specific health benefits. Probiotics must be treated almost like as a prescription drug. They should have a specific role. So prebiotics are the food for probiotics. So that's why following a low FODMAP diet for an extended period of time can have a negative impact on the gut microbiome. So should I take a daily probiotic to alleviate Sjogren's GI symptoms? Some studies suggest that probiotics may have immune modulating effects in individuals with ulcerative colitis, but research on Sjogren's is very limited. So choosing the right probiotics, typically you should consider, again, the probiotic as a prescription medicine that requires guidance from a healthcare professional. Some of the probiotics that have proven to be useful or helpful in relieving IBS symptoms are Activia, Align, also cultural. This was a really interesting question. So what's the evidence on spore-forming probiotics? So some evidence is showing that gram-positive and spore-forming probiotic strains could be more helpful than traditional probiotic supplements because of gastric acid resistance. Endospores, they can actually survive in the intestine. But to be honest, there is just emerging research. So the question was about the specific probiotic, the mega spore biotic. All the evidence that they have listed in their website are based on animal studies. I didn't see any human study. The only human study that I spotted was this one for functional dyspepsia, which is a chronic gastrointestinal disorder that can cause upper abdominal symptoms. And there's no like a structural disease causing this problem. And just like IBS, functional dyspepsia is considered a gall-brain disorder. So in this single center randomized trial, they took adult patients who have functional dyspepsia and were taking PPIs or pump inhibitors, proton pump inhibitors, and they were randomly assigned to receive a probiotic with a specific spore-forming probiotics. And they found that after 8 weeks, they did have some relief and abdominal pain. But keep in mind that these were adults that they did not have diabetes, they were not immunocompromised, and they didn't have any autoimmune disease. And that is the problem with a lot of nutritional trials and any dietary research, is that they exclude all the groups that have some chronic illness. So I just want you to be very careful to what to believe. So key takeaways is that individuals with Sjogren's may experience a variety of gastrointestinal symptoms that can greatly impact their quality of life. Individuals living with IBS often perceive foods as the main triggers, and just like we learned, is not the only one. Always try to consider food freedom strategies over an overly restrictive diet. And symptom management not only includes dietary adjustments, but it can also be supplements, cognitive therapies, relaxation techniques. And a registered dietitian can determine the most suitable dietary intervention for you. I cannot put all individuals with Sjogren's in one pool. I cannot paint them all with the same brush. So if there is something you saw here that you can take away and start doing, please don't wait for the perfect time to take action. Just do it today. And now the next Sjogren's got serious. So by popular demand was digestive enzymes for Sjogren's. I will follow the same steps. So you will get some teasers 5 days leading up to the webinar, all about understanding digestive enzymes. We can have a lively discussion here in the webinar. So let's connect. Please send me any questions. I would appreciate any feedback, and I want to answer your questions. So I hope you found this webinar helpful, and see you next month.